uniformly used, that is, it will take time. But as long as we can maintain, we have to maintain whatever we have. Like this one, the Singapore and China, they're using the robotic van for delivery of courier service. In our case, also, we are using the robotic uh, equipment for delivering of food and medicine in some hospitals only in India, but not all hospital robotic is used for COVID ward. But we can use, but it is in process that we will fighting. So we have to know how we can do, because everybody have a chance of infection. So it's very difficult to implement. So you can see this in Singapore airport and shopping mall, they using this type of robot, the to checking the temperature silently and moving around. This is the case of shopping mall in Malaysia. When you go, you just stand, your face will be scanned and with temperature. And you wash your, means take the sanitizer in hand. If you don't have the mobile, then security guard will note your name, mobile number, and temperature. Why? Because this is for cluster oriented spreading. They have to monitor. So as soon as, suppose, why train is closed in India, you cannot go from Mumbai to Delhi because the cluster of Delhi is separated from the Mumbai or Kolkata, from Udaipur. So all have to separate. If the cluster is mixed, then now like that type happened already, the community spreading is there and many persons is getting infected, and there is no, we don't have, nobody have in the world that type of facility to support this type of diseases. Cholera also same, plague also same, COVID also same. So even face mask is compulsory and you hand wash is compulsory here in Malaysia, that they are charging like in Indian currency maybe 17,000 rupees, 1,000 ringgit, very high amount. And but if we wear mask also, the same thing again and again I'm telling, the wash your mask after use, or if it disposable, dispose in proper places and use a fresh disposable mask. If we don't wash our mask, then is no use. If we don't wash our clothes, no use. We wash our mask, we don't wash our clothes. Then what is the use? We are coming from outside, the body and face both are infected, both carrying germs. So all should be washed totally. Like I am wearing a tie. In microbiology lab, you are not allowed to wear a tie and go inside because we don't wash our tie. We keep the tie aside, we or keep our blazer aside, and we moving. We just wash our hand, we just wash our clothes sometimes. We maybe somebody may wear the shirt for 3 days, 4 days. You just hang on a hanger. But it is not the way during this time, especially in new normal era. If we wear blazer also, if we wear tie also, we have to be very careful that this wear tie and blazer is not go outside our room. Okay. So finally, again, the hand hygiene. If we, you can see this hand. Every hand have different finger, 5 finger. So 5% have different type of mentality. 5% have different 5 types of facility. So facility also different, thinking also different, and my way of handling also different. But we should unite together here, and 5 fingers should work together. 5% should work together to fight against the disease. Any type of disease, not only that COVID, it may happen in hand and foot mouth disease, and also it may cause again the cholera or plague, anything is spreading by this hand. Be careful of your hand and wash it properly. Without hand, we are not capable to work anything. So we must be focused on our research on hand spreading. Wash our hand. Whenever you can wash. And also take precautions. During take food, you use a spoon, properly wash spoon and take that. Because if you take food, then the hand you have to wash water. That water you may not have. You may use tissue paper to clean your hand. That is not the way. These are the sources of contamination. Because the tissue paper box kept on the table by a waiter, and that waiter is washed the hand or not, you don't know. And this happened during our midday meal program, and also many festivals in the what you call wedding ceremony, when persons cooking, that spread the food poisoning. We know that is very well in many public health book, preventive medicine of park, if you follow, you can see this is normal thing, that spreading of diseases by hand poisoning. One person, previously in India, they call Daini. They kill that person in old age. That this person is contaminated. This is not that killing a person. We cannot kill everybody. We cannot kill ourselves. We have to be careful. Where is the source? The source is from the saliva or the germs and the bacteria and virus spreading. So break the chain by washing the hand. With this, I am thankful again to ITM, Baroda University, Gujarat, for giving me this platform to speak on the future research area. And of course, there are many papers have been come out in Scopus and etc. But many papers retracted also during this COVID lockdown era, because no review has been done properly. But it is common and it is universal. And this WHO guideline is not prepared today. It is long back has been prepared. And this YouTube video, what I shown is not today. It is long back prepared. And the British people not using the fork and Chinese people not using the stick from now, using long back. Why? To spread the contamination, to stop spreading the contamination by hand. Thank you all. And thank you again to Dr. Digvijay, Dr. Vimal, and also I would like to thank Dr. Proshun for introducing, and all the participants of this gathering of around, I think 180 participants is here in Zoom room itself. Thank you all for joining and spending your time, and please spread this message to everybody and use this hand hygiene in your everyday life. Wear mask, stay safe. Thank you all.
Thank you, sir, for such a...
Thank you, Dr. Poddar. Thank you very much.
Thank you, sir. Any question from the audience? I can.
Yeah, anybody have any questions?
Or they can also, you can share my email ID or WhatsApp number. They can email me and I can reply. No problem. Sir, I think you meet it, or you can speak, sir.
If anybody is having any questions, please write them in the chat box.
So according to you, sir, that's the safety is important, right? Personal safety is important for preventing the corona, COVID-19, and that definitely will improve the immunity.
Yes, sir. Because the safety is very much important, because corona can be affect to doctors also, nurses also, and
Yes,
also
sir.
not only corona, other disease also is there. Not that only corona is persisting. So TB is also there. If TB is affected, then if it is affected not only lung, it may affect the uterus, and person may not carry the baby also in future if TB is affected the uterus. So, there are many diseases can be spreaded. Like I told that cholera, and this cholera is not gone yet. Diarrhea, normal. These are all normal things, and many persons dying. Not only and COVID, we know already that, like the singer, you see that I have seen the video in WhatsApp that in hospital he think that okay, within 2 days I will go back, but he go back to his own place, not in home.
Yes, yes, yes.